Good evening. Welcome to the clinic. What are you here for tonight? You say you've been having some issues with your eyes. I see. Well, my name is Dr. Late Night, and I will examine you over tonight very thoroughly to make sure that we identify whatever is going wrong here, okay? Most likely you will end up with some lenses, but I'm going to be screening you for a variety of problems you may have, okay? Perfect. So starting out, I'm just going to take a quick look over you. And I want you to let me know if you experience any discomfort at all throughout this exam. You shouldn't at all, but just let me know, okay? So I'm just taking a look at your eyes here. Just relax for me. Okay. I'm going to get my light. Might be a little bit bright, but it won't hurt you. I'm going to lift up your eyelid here, and I want you to look up for me. Good, and look down. Okay, look to one side. Very good, and then to the other side here. Okay, and then blink a few times. And I'm going to do the same your other eye, just lifting the lid up. Okay, look up for me. Good. Look down. Okay, to one side. Very good. And then to the other side for me. Alright, perfect. Now I just want you to look straight at my nose, okay? And I'm just going to observe your pupillary reaction. I'm also looking to see that your sclera are white. I don't see any burst blood vessels. Anything to be concerned about. Okay. Very good. Now, have you ever had any issues with your vision in the past? Or is this a recent occurrence? Okay. And does anyone in your immediate family have problems with their vision? Your parents, grandparents, siblings? Okay. And any past of excessive dryness or overwatering of the eyes? Alright. Very good. Now I would like you to just focus both of your eyes on the tip of my finger, okay? And just follow it as it moves in and out. And in and out, okay? Keep focusing on the tip of my finger, moving it around, and I'm just observing how your eyes track. Do you have any blurriness as I'm doing this? Okay. And my finger is clear in your vision? Good, okay. Out one more time. And in towards you. Very good. I hope you've had enough break from the light, because I'm going to conduct another eye exam. So I want you to just look straight at my nose, okay? And I'm just observing how your pupils react here as well. Okay. Closer here. Just focusing on my nose, if you can. Okay. Good. Just relaxing for me through this. Okay, perfect. Now, I would just like you to focus your eyes both on this light and follow it all around for me, just as you did with my finger. Again, I'm checking both your pupillary reaction and how your eyes track. Okay. Any problems following the light? Okay, very good. Perfect. Go ahead and blink a few times. Next, I have this vision chart here. So what I want you to do is just go ahead and cover one of your eyes. Okay? Go ahead and read that top line for me. Good. And the second line. Okay. Third line. Fourth line. Can you read this one? Okay. Here. And the bottom line. Can you read that? Very good. Go ahead and swap eyes for me. And read this top line here. The second line. Good. And the third. Okay. Fourth. Fifth. Wonderful. Sixth. And the smallest line here. Can you read that? Very good. We're going to do about the same thing, but I'm going to turn down the lights, alright? So just give me one moment. Okay, now I'm just going to ask you to do the same thing again, occluding the original eye. And see if you can read this top line here. Okay, and the second line. Very good. The third. Fourth, fifth, sixth, good. Any issues with that? Okay, good. Seventh, and the eighth. Alright, and switching eyes. This one here. Good. Second line, the third line, fourth, fifth, 7th, and the 8th. Wonderful. Now, while we have this dim lighting here, I just want you to focus on the tip of this light wand and just follow it, okay? Good. Okay. Any issues with the dim lighting? Do you feel your eyes straining or any other issues? Any blurriness, dizziness? Okay. Good. Okay. Good. You can relax your eyes again. And I'm just going to turn the lights back up. Alright. I'm going to test your color vision now, okay? So you can keep both eyes open. And I just want you to tell me, what color is this? Very good. Now I want you to occlude one of your eyes, okay? And take a good look at this color. And switch eyes. I want you to tell me if it looks like the same shade of red on both sides. Okay? Very good. Go ahead and occlude one of your eyes again. Now tell me, what color is this? Good. Okay. What color is this? Very good. And that. Okay, go ahead and switch eyes. What color is this? Good. And this. Okay. And what is this color? Okay, very good. And I want you to go ahead and do the same thing for me that we did before, including your other eye, and just looking to see that this is the same color on both sides to you, okay? It's the same shade. Okay, very good. You have no problems with your color vision. I want you to go ahead and look at my nose again, okay? And I'm going to be flashing up some numbers on my fingers in your peripheral vision. And I just want you to add up the numbers that you see on my hands, okay? Good. Looking straight at my nose. Good. Very good. Okay. Wonderful. All right. Good. Okay. Wonderful. Very good. Now, keeping your gaze fixed on my nose still, I just want you to tell me which finger comes closer to you, okay? Good. Resetting. Okay. Very good. That's right. Okay. And one more time. Okay, perfect. Now, I just want you to relax for me. You can just look forward, focus on my nose if that helps, or whatever you prefer. But I'm going to be taking some measurements of your eyes and your face, okay? Alright. Measuring your eye here, your pupil as well. Good, and then from the bridge, your nose here, the outside of your face. Okay, and the other side, I'm checking your eye, your pupil. Okay, the nose, the outside of the face. Good. And distance between the eyes. Okay, wonderful. Now, I'm going to measure from the outside of one eye, the outside of the other. That's right. Okay. Just double checking my work here. Very symmetrical face. Okay, and some basic measurements of your forehead. Chin. Okay, your nose. These will be important as well for fitting you for lenses if we decide that that is the route that we need to go. Okay, wonderful. I have this little cotton wisp here, and I'm just going to very lightly tap you on your eye, and I'm just testing the reflex there. So the normal response would be to blink. So I just want you to look up for me, okay? And just very gentle tap. Shouldn't be uncomfortable, just to trigger the response. Good. And the other side. Okay. We're doing it one more time on each side just to be sure. Okay. Very good. You can look down again. Now I want you to look straight at my nose again, okay? I'm just going to be bringing my fingers into your peripheral vision. I want you to tell me when you can see them, okay? Looking at my nose. Good. 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 Okay. Perfect. Very good. Wonderful. Okay, good. Now using my lights again, I want you to focus on this one. Okay. Now switch and look at the other one. Now switch back and over to this one. I just want you to keep looking back and forth as they move. Switching every second or so. Okay, now fixate on one light. Stay there. I'm just going to take one last look at you here, pulling up your eyelid just gently, taking a look at your lid and your tear duct, all around, making sure I didn't miss anything. I don't believe I did though. Alright, and on your other side here, just taking a look. You've been a very good patient this evening. Okay, very good. And you can just relax. I'm going to take one last feel around to make sure there's no inflammation, lumps, bumps, or dryness around your eyes. Okay, just double checking here. Good. Okay. Perfect. Wonderful. Okay. I don't believe that we've missed anything tonight. Seems that you are going to have to get some corrective lenses, but there are no other major problems with your eyes. This is very normal to need glasses. More and more people every year are needing them for even just reading or long distance. Right, so we will have to schedule you a lens fitting and also to figure out your exact prescription, as today was just an exam to determine the underlying issues. Alright, well, thank you for being such a wonderful patient, and I will see you again soon. Have a lovely night. Good night.